Welcome everyone. Happy Thursday. Before we start, I'm going to give some technical guidance. We're doing something that is new to me. We're going to do simultaneous translations of this presentation. So if you want to hear this translated into Spanish or Amharic, we have translators who will be translating for you. And there are instructions in the chat for how you would choose those translations. Even if you want to hear the presentation in English, I would suggest you follow these instructions, because if anyone asks a question in another language, you will hear the interpretation of it. So in English, if you want to hear this in English, you would click on a globe-like icon at the bottom right of your Zoom window. If you're on a laptop or a computer, you'll see a globe, and you would select English. If you're listening on a tablet or a smartphone, you'll click on 3 dots at the bottom right of your Zoom window, and then you click on language interpretation, and then you choose English. Now, in English, if you don't do that, you are still going to hear me, but you might not hear any questions that come to us in Spanish or Amharic. And I'm going to pause a moment and have our Spanish translator give those instructions in Spanish.
Buenas tardes. Para poder seleccionar el canal de español, vayan abajo a la parte donde tienen un icono del globo terráqueo. Ahí van a poder seleccionar interpretación español en caso de que nos estén viendo en una computadora. Si están desde una tableta o celular, esto les va a aparecer en los 3 puntitos o la opción de More o Más. Y ahí van a poder también seleccionar interpretación español. Gracias. Jen, they won't be able to say it out loud in Amharic because they're both assigned already in the booths, but they have the instructions in the chat.
Okay, thank you. So there are 2 Amharic interpreters are already in the sort of Amharic room, so they're not going to say it out loud to you. But if you feel more comfortable hearing this in Amharic, the instructions are in the meeting chat written in Amharic about how you would get into that room to hear it. So a lot of technical stuff at the beginning. This is new for us, but we think that this would be a good way to present to you. And with that, I'm going to turn it over to Sia Barbara Kamara.
Well, good afternoon and great day to everyone. Special thanks for joining us today for this conversation so that you can learn more about healthcare for childcare in Washington, D.C. I'm Sia Barbara Kamara. I'm the Chief Strategy Officer with the DC Early Learning Collaborative, and we are working in partnership with 9 other partners to help bring this conversation, tonight's conversation, and Saturday's conversation to you and your colleagues. And we certainly want you all to know, and interpreters, if I'm talking too fast, let me know, that this is an opportunity available to people regardless of position in your program. Whether you're the janitor, the cook, the teacher, the director, the bookkeeper, whatever position you have in your program in a licensed center or home, it's for you. And so thank you for joining us today. We definitely want you to ask your questions because this is all about you, about your getting additional information to help you make a decision for your program or for yourself. Thanks again for joining us, and thanks also on behalf of our advisory committee, and you will hear from our chairperson of the advisory committee to Healthcare for Childcare, Kathy Howley-Minkle, later on. Thanks.
Thank you so much, Sia. My name is Jen Beeson, and I'm the Director of Marketplace Innovation, Policy, and Operations at the DC Health Benefit Exchange Authority. also known as DC HealthLink. And I'm going to be doing a lot of speaking today. But what our goal is for today is that we help give you some basic information about healthcare for childcare. And we encourage you to tell your colleagues. We have another town hall conversation tonight and another one on Saturday. So if you have colleagues who might be interested, if I get one thing across from you, it is please let them know that we have more town halls coming and we'd like to get anyone who has questions to join one of those meetings so we can give you the basic facts. I'm going to do a presentation. We're going to take questions and answers. And then at the end, I'll turn it over to Kathy Hollowell-Mackel, who is a chairperson of an advisory committee we created around healthcare for childcare. And before I get started, I do want to thank Sia from the DC Early Learning Collaborative and all of our partner organizations who were part of this, including DC AEYC, the DC Directors Exchange, DC Family Care Association, DC Head Start, MSSPA, Spaces in Action, Washington Child Care Centers Association, DC Action, Under 3DC, DC Child Care Connections, and University for Kids. All of those groups thought that this was important information for you all, so we came together. With that, let's launch. Let's learn about healthcare for childcare. So, DC HealthLink. Before I tell you anything about the program, I want to tell you about us and who we are. DC HealthLink was created from the Affordable Care Act, or Obamacare, and it created a place for families and businesses to get affordable health insurance options. We are a public-private partnership with an independent board made up of members of the community, and we provide affordable health insurance options through two different marketplaces. And I'll come back to this idea of two different marketplaces as we go through the presentation today, because it makes a difference according to what you might qualify for. So in our individual and family marketplace, we provide health insurance options for individuals and families in the District of Columbia. About 15,000 people in DC get their coverage through that marketplace. And then we also have another marketplace for employer-sponsored insurance. So when your employer offers you coverage, there's another avenue for you to get insurance through our employer-sponsored insurance. We sometimes call that our shop marketplace. And we have more than 5,000 businesses in DC who get their coverage through our shop marketplace, as well as members of Congress. So that's a little bit about DC HealthLink. Now let me talk a little bit about, let me talk about this. So what is it that we are offering at DC HealthLink? There's our individual and family marketplace. We have two insurance carriers that offer plans, Kaiser Permanente and Care First. And all of their plans they're real insurance. They're real insurance. They're Affordable Care Act plans. They cover doctors, hospitals, lab work, prescription medication, and other services. And in our small group marketplace, we have 4 insurance carriers, Kaiser Permanente and Care First, but also Aetna and United Healthcare. They have nationwide networks. Again, all plans are Affordable Care Act plans. They cover doctors, hospitals, lab work, prescription drugs, and other services. Okay, let me talk a little bit about healthcare for childcare. I'm going to talk at a high level about different options and what you might be eligible for. And then I'm going to talk a little more detail about the plans themselves. And then we'll just take questions. So Healthcare for Childcare is a program that helps OSCE licensed child development centers and homes provide affordable health insurance for their employees. Free and lower premiums through this program are guaranteed for 12 months from the date that you enroll. Now, Sia mentioned this at the beginning, but all employees at a child care facility qualify for this help. You don't have to be getting the wage supplement. If you are a part-time worker, if you are in the custodial staff or food and nutrition staff, a social worker, an administrator, undocumented workers, all employees can qualify for this health insurance assistance. So let me talk a little bit about the types of ways you can get covered. If you are a district resident, you and your family could get free health insurance premiums by going into our individual and family marketplace. If you do not live in the district, you would qualify for free or lower premium health insurance if your employer offers insurance through that employer-sponsored marketplace that I talked about. For district residents, the free health insurance premiums are available for both you and your family members. For the non-district residents, the free or lower premiums are only available if your employer offers you coverage. Now, a note here, HealthCare for ChildCare pays for the health insurance premiums. That's the monthly amount that you would normally pay to your insurance company to be covered. However, there are still other costs. You would be responsible for any deductibles, co-payments, or co-insurance. For example, if you go to the doctor, there may be a co-payment that you pay. So it's not 100% free coverage, it's free premium coverage. I'll talk about that a little bit more later. Okay, let me dig in here for the District of Columbia residents. Whether or not your employer makes any decision or not, you are eligible for free premiums through our individual and family marketplace. If you reside in the district, you and your dependents, meaning your spouse and your children, would get coverage. You have an option of one of 3 different insurance plans that you could choose. You could choose Kaiser Permanente Standard Silver Plan. You could choose Care First Standard Silver Plan HMO Plan, or Care First Standard Silver Plan PPO Plan. And if we have questions at the end about what the difference is between HMO and PPO, I can go into that. But for now, I just want you to know you've got 3 different plans to choose from, and it would cost you $0 per month. You would get it for yourself, your spouse, and your kids, and your employer does not need to do anything for you to be eligible for that. Let me talk about my non-District of Columbia residents. For those who do not live in DC, your employer must sign up to offer insurance coverage through our small business marketplace, our shop marketplace. And you would get a discount, and it would apply to you as the employee, but not necessarily to your dependent, not necessarily to your spouse and your child. The discount is pegged to your age, and it's pegged on the lowest cost standard silver plan. You don't need to know what that plan is, but I'll just tell you it is $277 for a 30-year-old. Now, if you're older than 30, that discount is higher. If you're younger than 30, that discount is a little lower. And depending on how your employer sets up the plan, it may be of no cost at all to you. Let's go to the next slide, please, Alan. This is a little bit more about our non-DC residents. So whether the premium to you is free or lower depends on what the employer decides to offer. and the plan that you decide to select. So for non-district residents, the employer would say, yes, I want to participate. I want to offer a plan through the shop marketplace. They would choose a level of coverage, silver, gold, or platinum. And they would choose a plan that they want to have as their sort of key plan. And they would decide what % they would contribute. And that is going to determine how much you owe. We have many people who are already participating in this plan. I'll just stop here. Many of our non-district residents are getting coverage for $0 per month because their employer has structured their plan so that they do not owe anything. Okay, keep going. A little bit more about the plans that we offer. You heard me say earlier that the plan in the individual or family market that you can choose from is a Kaiser Permanente standard silver plan or a Care First standard silver plan. That terminology, standard plan, is something that DC HealthLink uses to denote a special kind of plan that we worked with the carriers to help make insurance more affordable for people. Deductibles can be a struggle. Standard plans make it easier to get essential medical care when you need it. So it will cover some essential in-network services without having to meet a deductible. If you don't know what a deductible is, you are not alone. Deductibles are a little confusing. It is an amount that you would pay in a plan year before your health insurance begins to pay above and beyond your premium. So let me tell you a little bit about the coverage that you would get under a standard plan. Standard plans cover a lot of services before the deductible would even apply. You would get to go to primary care visits, specialty care visits, generic drugs, urgent care, outpatient and mental health care, outpatient substance abuse treatment, even type 2 diabetes treatment is covered with $0 cost to the patient. There'd be no deductibles, no co-insurance, no co-payments for doctor visits, lab work, eye, foot exams, prescription drugs, and supplies, including insulin. So that's why we are putting so much emphasis on these standard plans. And if you sign up for one of these standard plans and you are just using these services, your monthly premium would be $0, and you would not have to meet a deductible for any of these services. I just want to make a note about Medicaid and Alliance. If you or your family qualify for Medicaid, Medicaid is a better coverage option than HealthCare for childcare. And we would encourage you to stay in Medicaid because Medicaid provides totally free comprehensive coverage for residents. And the plans in HealthCare for childcare still do have some costs associated with them. You know, like we said, the deductible or maybe a copayment. So if you do qualify for Medicaid, we want people to stick with Medicaid. And we have some instructions in here wanting to remind you that you should log into your district direct account and update your contact information. Because Medicaid will be redetermining eligibility this year. And I'm happy to take questions about that. Medicaid is not part of DC HealthLink, but we talk to each other. And so, again, if you qualify for Medicaid, stay in Medicaid. If you have Alliance coverage, you can also qualify for HealthCare for childcare. So that will sit on top of your Alliance coverage. Now, many in the childcare community were already offering health insurance to their employees before we launched the HealthCare for childcare program. So for centers and homes that provided health insurance to their workers in 2022, you can keep the same plan or a very similar plan and get a discount. And that would be for both DC and non-DC residents. In other words, your District of Columbia residents would not have to go to a different place. They would not have to go to the individual marketplace to get their coverage. They can keep getting it from you or from the employer. And again, that discount, which I mentioned earlier, it's $277 a month for a 30-year-old. But it would go up if you're older, it'd go down if you're younger. And the discount is pegged to the lowest cost standard silver plan. Okay, whew, that was a lot of information. Now I'm just going into the action steps here, the important part. So how do I enroll? I put all this information on this slide for you. Essentially, your takeaway is you can't do this on your own. We're going to help you. And there is an email where you could email us and ask for help. There is a link in this slide deck, which we will send out to all participants in this webinar. So you'll have this. That is a link directly to make an appointment with one of our enrollment specialists. That's for district residents. If you are a non-district resident, your employer needs to take action. There's that email address again, hc4cc@dc.gov. And there's a link for your employer to make an appointment so we can help set up a small group market plan for your employer to offer you. And at the bottom there, I've just put a link to our website. When we give you these slides, I'll make sure you see the links for how to take action. Let us open it up for questions at this time. You can unmute yourself and ask a question. The line is open. You can also type a question in the chat because I'm monitoring the chat.
I have a question. You had stated that if you signed up for Medicare in the district that it was totally free. I was kicked out of the insurance program on the first of the month that I was turning 65. And I had to pay for Medicare, and it was almost $600 for starting on March 1st because my birthday was March 15th. And they said that I had to pay, the bill came for almost $600.
And you're talking about Medicare, and I was talking about Medicaid.
Oh,
And yeah, they are different. Medicaid is a different program from Medicare. And I know that Medicare can be quite expensive. There are some cost-saving options for Medicare. I'm not an expert in, but I would be happy to try to connect you with someone who could help at least find out if you qualify for some of those cost-saving plans, that cost-saving programs that are part of Medicare. So if you want to, I'm going to put my email in the chat. Renita, I don't want you to, you don't need to put your email in the chat because not everyone needs to see your email, but if you want to email me, I would be happy to try to help connect you with someone who might be able to find some more affordable Medicare options. Because you're right, Medicare is way too expensive.
yeah. So this program is never going to allow anyone 65 and older, even, you know, although we're working, is not going to allow us to stay in the program.
I don't want to answer that question right now because I don't want to give you incorrect information. So far, I do not have any enrollees who are above 65, but I need to research before I tell you a firm yes or a firm no. So if you want to email me afterwards, I can follow up on the Medicare plus healthcare for childcare option. I have some thoughts in my head, but I don't want to say them because I don't want them to be wrong. Let's say that.
Okay, just give me a little hope. That's all I ask for, a little hope. Okay,
Understood.
thank you.
Yeah. And then I want to say that when I was distributing flyers to centers, I ran into this with a person who asked this very same question. She's 65. She is getting Social Security, and she wondered about her options. So I think this is not just a question from Renita. I think there are others who have it. So once we have and a response, it needs to be made available broadly. Thank you.
Thank you, Barbara.
Speaking up for you there. Do I have other questions?
Hi, Jennifer. This is Joan from the Board of Childcare. I would like for you to share a little bit more about how our employers are going to be connected. I'll use me as an example. If I wanted to apply for this, I do have insurance offered to me, which I have coverage through my agency. I wanted to see, what does my employer have to do with this if I decide to say I no longer need coverage from you, because I can now depend on healthcare for childcare? Like, what role do they play in this, except me terminating my policy from Care First on my end?
Yes. So if you are, and so you're a district, let me just clarify, you are a district resident, correct?
I am a
Okay.
district resident.
So you would be eligible to get $0 premium coverage through the individual and family marketplace, but you would have to terminate your coverage with your employer. And we can work with you on that. Some employers discourage the terminating of the plan before the end of your plan year. Because you have coverage, you also have a plan year. There is some month of the year where you would sign up or not sign up.
Open enrollment, is that what you're
Yes.
referring to? Yes, open enrollment.
Do you know when your open enrollment is?
It's actually in May.
Okay, so this would actually be a really good time for you to talk with our team, because then you could decline your employer sponsored coverage and come in. But and why I'm sort of encouraging you to speak with our team is I think it would be helpful for you to see a side-by-side comparison of the coverage options, because you want to make sure you're making the right choice.
Alrighty, awesome. I have one more question, and that is, you mentioned that this is good for 12 months. What guarantee do we have that this is going to roll over for additional 12 months, or do we re-sign up or go through open enrollment again?
Yes, so we are, I can't make any guarantee because I don't have the budget authority beyond the 12 months at this time, but we are working hard to make this a successful program and enrolling people so that we can make a demonstration that it's a needed and necessary program going forward, and that there will be funds made available through the funds are actually come to us through OSSI.
All righty, thank you so much.
So Joan, very specifically, when I email you the slides, or when we email you the slides, I would, if I were you, click on the link to set up an appointment for the individual and family market and come, prepared with some details about your current employer offered plan, so you can do a side-by-side comparison and make a choice.
Got it. Thank you.
Any other questions? Oh, I'm supposed to be looking at my chat here. My company just started in February 2023. DC Health told my company I had to cancel my old Maryland insurance to start this one. Now with the same plan, my co-payment insurance is way more expensive. Why was this class not offered earlier? DC Health told my company I had to cancel my old insurance. I'm not sure what that means. Ms. Lewis wrote that in the chat. I'm happy to follow up with you afterwards. I'm not sure I understand your question. If you want to unmute and tell me a little bit more about your situation.
Okay, good afternoon. This class that we're speaking in gives more depth to how this works. My Maryland insurance had partial, I guess, Medicaid with it. So you're saying that if you have Medicaid, you should have kept it. So I would have kept it. This insurance, now my medication is like, one of them is like over $1,000, another one is $2,000, and I can't afford my insurance. I mean, I can't afford my medications anymore for the families, and plus I still have to pay the copays, which all my copays have gone up for my regular doctor, specialists, everything. So it's way more expensive. You can't afford it on a teacher's salary. So I would have just kept the Maryland insurance instead of doing a little more investigating.
Do you live in the District of Columbia?
No, I live in Maryland. That's why I had Maryland insurance.
Okay. And so your employer, are they offering insurance?
They just came to us and saying, we're going to offer insurance. Our plans will be better than your regular ones. Just check out what you have. And so I just picked the same one I had, which was the silver plan with Blue Cross Blue Shield. I just picked the same exact plan that I already had, and it's just like totally different.
Okay. So it sounds like there might be a couple different things going on there, but I would love to talk with my specialist. Sorry, I'm echoing. Maybe, yeah, put yourself on mute. It sounds like there could be a couple different things going on. It sounds like I'd love to connect you with one of our enrollment specialists to go through your details, because you also threw in there Medicaid, and I just want to make sure I just want to make sure we're clear. Like, I don't know if Medicaid in Maryland had something to say about your Medicaid coverage. So let's just talk, and maybe we can find a way to help you or help your employer maybe come through this program, because it sounds like maybe they're not coming through HealthCare for Childcare, and we can bring them on at any time and help them get a discount and help them set up a plan so that it is more affordable for you. Okay, I have another question. Are providers still able to sign up at this time? It sounded like the window closed a few months ago. No, they can sign up. They can sign up at any time. They can sign up right now. If the employer wants to sign up to offer coverage to their employees, if you wanted to offer coverage for May 1, the window just closed. But if you want to offer coverage starting June 1, you have from now until early May to connect with my staff, and we will set you all up so you can start offering coverage starting June 1 for your employees. Any other questions? I'm going to write in here one more time. Oops, I wrote it just to my questionnaire. I'm going to write it to everybody this time. My email address, so that you have time to write it down. Pretty simple. My first name, Jennifer, last name B, as in the insect, SON, @dc.gov. And you can follow up directly with me with your questions. I have a question in the chat about the difference between Obamacare and ACA and what you are offering. Our plans are part of Obamacare. We were created 10 years ago as part of the Affordable Care Act. And the Affordable Care Act set certain standards for insurance plans that they have to offer coverage benefits at a certain level. All of our plans do that. In the individual and family marketplace that I talked about, that's our ACA marketplace for individuals. If you were not in the HealthCare for Childcare program, you could go to that marketplace and you might qualify for tax credits, Obamacare tax credits. What we've done is we've leveraged that marketplace to give you the coverage for free. So it's the same thing. We're just saying, you know what? You don't even have to pay the premium. We will pay that for you.
So please ask your questions. I'm sure something wondering. The only bad question is the one that you didn't ask. So this is a time to ask anything that you've been thinking about, things you've heard.
And if you
Nothing else in
found
the chat.
the link to this, you probably have the link to the 7 p.m. or the Saturday session. So I would encourage you to share that widely with your networks, with your colleagues, with your friends. Do employees that have DC Healthcare Alliance, can they change to this insurance? You can actually get this and have it sit on top of Alliance. In other words, you don't have to get out of Alliance. You can just also get this. And we would encourage that. So that was a question about Alliance coverage. And again, you would click on that link that we're going to send you about making an appointment. And you'd set up an appointment with our specialists. They already know about Medicaid. They already know about Alliance. So they're going to ask you those questions. And they know that if you have Alliance, you can sign up for HealthCare for Childcare.
Jennifer, is there a helpline telephone number that you can share if folks have questions and would like to get in touch with someone? Is there a number that you can share as well?
We do have a contact center that services our normal customer base, and I can share that with you. I will tell you that the contact center representatives, what they're going to do is take your name and phone number down and escalate it up to my specialized team. Because what we're doing is somewhat complex, and we are the people who have to make the changes in the IT system to actually, flip on the coverage. But I'm happy to give you the 1-800 number. I could put it in the chat. Maybe Isabella, so that I'm not multitasking. I think Isabella on my staff is here. Isabella, if you're able to, can you write in the 1-800 number that, I should have memorized, but I'm not a numbers person, so digits do not stick in my head. I'll put that in the chat, but I do just want to warn you, like, you're not going to be able to enroll just by calling the number. They will take your information down and send it to my team, and then we would contact you.
Thank you.
Oh, good. Isabella wrote it down. Thank you for hearing me. 855-532-5465. And we just put in a little message at the beginning that says, if you're calling about HealthCare for Childcare, press whatever number it is. And so you can actually just fast forward to that. Thank you for that question, Kathy.
I think there's another question in the chat.
Sorry, I'm happy to jump in.
Yeah, go ahead, Catherine.
I had a little typo in there, so apologies. But our private insurance option runs, our open enrollment is in the late fall, and then our new plans or premiums go into effect in January. Is it possible to, if we wanted to pursue this, to sign up around that timeline in case the funding for this changes so that there's no gaps in coverage for any staff members?
Yeah, we would work to make sure there's no gaps in coverage. And what I would encourage Are you the decision maker at your place?
I make many decisions, but often larger ones in consultation with our board.
Okay.
Yeah.
What I would do is, well, first of all, depending on what you currently, okay, I'm gonna get into it now. Depending on what you currently offer, you may want to consider actually leaving that plan and coming to our plan. We have helped other employers do this because they found they saved so much money that they were willing to leave mid-year.
Yep.
Employers that did that typically were offering plans without an annual deductible, and so there wasn't too much disruption in the coverage for their employees. Other employers have been not quite willing to disrupt their plan year. And so we will work with them to make sure there's a smooth transition, that there's no gap in coverage. And we can do that for you. So if you are willing to explore leaving your plan year early, make an appointment with our team and we kind of mock up what your costs could look like. If you are totally sure, I do not want to do that, get in touch with us a little later in the year as your plan year is coming up for renewal, as you get closer to open enrollment.
Okay. And do most companies or childcare providers that opt for this, do they typically drop their private coverage, or are others offering both?
We have had some employers who dropped the coverage that they were offering to join DC HealthLink because they saved so much money to help.
I'm sure.
And they drop their coverage in the middle of their plan year.
Yep. Okay. Thank you. Very helpful.
But this is why I'm so glad you all are here. Health insurance is not like the most fun topic, and it's pretty complex. It's like doing your taxes, it must be done. It's not so glamorous. But that's why we have specialists who are willing to dig deep into the weeds with you all and go back and forth and talk about different options and different plans. So again, it's why I'm encouraging you. I can't give you everything in this webinar today, but encouraging you to learn more by making an appointment with our team.
And Jennifer, I know you encouraging people to contact you and your team, but you will conduct side-by-side analysis for them. Is that correct?
Yes.
So they can compare what they currently have to what they would potentially get.
Yep. And if your workplace currently offers insurance, typically you have a broker, an insurance broker. We sit down with the broker. Because the broker is very helpful in being a mediator, a mediary between what we are talking about, what you currently have, and we'll simplify things. So we're very happy to work with your broker, with or without you. Does each employee need to establish coverage, or can an HR department sign groups up? So, Dominique, I would say in an ideal world, the way our shop marketplace is set up is to provide many options for employees, so they have lots of control over like what they want their plan to look like. However, having said that, we frequently work with HR departments or employers to help basically sign people up for the plan that works best for them and the company. And we don't have the employee do all of the shopping by themselves. So if you want to do this option and offer employer sponsored insurance and get the discount, we can work with you on how we handle your employees to get them enrolled. Or if you have a broker, we'll work with the broker. I hope that answers your question. If not, unmute and just tell me, no, I'm way off base. I didn't understand. Okay. There's some great questions. Anything else? With that, we will follow up with the slides. We're gonna send them to you. I think we can do that because we set up the Zoom, so I think we can email all participants. And I'm gonna highlight 2 different links for making the appointment, one for employees and one for employers in that email. Kathy, do you have any closing remarks that you want to offer to the group?
Good afternoon, everyone. Thank you, Jennifer. I just want to thank all who took time out of their day today to attend. Thank you for coming. Hopefully you got a little bit more information to help you make a decision or to share it with your friends and colleagues that might be eligible for healthcare for childcare. I also would like to take this opportunity to thank the folks at DC Health Benefits Exchange for being so diligent and responsive to all the needs and questions that you guys may have. We are always available, Sia with DC Early Learning Collab, myself with DCAUIC, to field your questions directly to the folks at Healthcare for Childcare. So if there's anything you didn't get a chance to ask or you think about later, reach out to Jennifer, myself, or Sia. We'll be happy to connect you to the right folks. And if you know anyone who wants who needs additional information, there'll be a session tonight and a session on Saturday, and hopefully they'll be able to attend. And that's it. Thank you, Jennifer.
Thank you. Last slide. If you want to use your little QR codes to register. And again, we'll send those out so you can send those registration links to friends or colleagues. I think that's it. Thank you, everybody. Have a wonderful Thursday afternoon.